Africa is supposed to receive 90 million doses of vaccines from the joint UN-led COVAX initiative this month, but how much more needs to be done as high-income countries buy up most of the supplies? And competitors or potential partners, that is the question for US and China. Or can it be both? What role is climate change playing in defining their relationship? Welcome to The Point, coming to you from Beijing. I'm Wang Guan, sitting in for Liu Xin. COVID-19 vaccination campaigns are being rolled out in countries around the world, but many people in Africa are still waiting. The scheduled rollout will support just 3% of the African population by the first half of this year. With concerns growing over new variants, what is the picture for African countries' vaccination drives? How to make sure the continent gets equitable access? And what are the most critical concerns surrounding vaccine nationalism? Joining me today from Edinburgh via Skype is Linda Bauld, Professor of Public Health at the University of Edinburgh. And from Kuala Lumpur is Hannah Ryder, CEO of consulting firm Development Reimagined. Linda, in Edinburgh, let me go to you first. The new variant discovered in early February has, of course, impacted several African countries by now, like Kenya and Zambia. How concerning is the new variant?
So it's a real challenge for all countries that are being affected by these different variants. Just in the last week in the continent of Africa, there were over 175,000 new cases of COVID-19, over 6,000 deaths. So it has not gone away. What this variant from originally identified in South Africa, and that's a country with good genomic sequencing capacity, the reason it causes concern is because the mutation is to the spike protein. There are more changes for this variant than we've seen in some of the others, and it's pretty clear from the data that's been presented that it is more transmissible. Essentially what it does is it's able to attach itself to our cells more effectively than some of the previous variants, and we think that people have a higher viral load when they pick up this particular strain. So it's causing real concern in Africa. There's huge variability across the continent, but it's very much the case that it has accelerated some of the admissions to hospital and the people who become unwell just in terms of the sheer numbers. So it's important that African countries just deal with COVID-19 generally, because one of the reasons these variants develop is when you have high rates of high incidence and prevalence of the disease in a population, it gives the virus an opportunity to change as it transfers from one person to another. So you must suppress COVID-19 to prevent more of these worrying variants being produced in future.
Right, it is a dual challenge. Hannah, let me go to you in Kuala Lumpur. South Africa just paused its plan to use the Oxford AstraZeneca vaccine amid concerns that it is not effective, at least not effective enough against the new variant. However, they will move ahead with the development of vaccines made by Pfizer and BioNTech and Johnson & Johnson. How do you look at the relationship between these new variants and the efficacy of the vaccines in use now?
Look, I think what's happening with the majority of African countries is, like South Africa, they're looking at all different possible ways and different possible vaccines that they can get. Of course, South Africa has more cases than the rest of the continent, than most other countries in the rest of the continent. And they have also more capacity to be able to test, as Linda was saying, they'd be able to test whether these vaccines will be efficient and so on. The issue for the other African countries is, can they even get the kind of access that South Africa has got in order to be able to vaccinate enough of their populations? And whether that's from AstraZeneca, whether it's from China or anywhere else, they are looking in all directions.
Right, and then do you think are we going to need to invent more new vaccines for all the new variants that emerge, or should we just focus on preventing and controlling the existing, people with the existing conditions?
Well, there is, of course, look, this whole journey with COVID-19 has been one in which there's been extremely unequal access in many ways for African countries to deal with these sorts of, with the vaccine, with the vaccine issues, but also if you go to tests, if you look at the kind of fiscal response that African countries have had. Now, while we might want to be able to say, look, okay, African countries or South Africa, be careful about this variant or be careful of that variant. The fact is, they are not really getting a choice at the moment. Most African countries do not manufacture the vaccine. They're waiting to get vaccines from elsewhere. They're having to order it from elsewhere. There's 25 African countries that have still not ordered any vaccines whatsoever. So talking about new strains and dealing with new strains of the COVID-19 virus with new vaccines is so many months down the line for the majority of African countries. What they're working on right now is even just getting access, full stop.
Right. I see what you're talking about, and I feel it because COVAX, for example, aims to secure 600 million doses of vaccines, covering 20% of African population by the end of this year. But there's a lot of talk of how higher income countries are hoarding the vaccines, with Andrea Taylor, a Duke University researcher, saying that higher income countries account for 16% of the world's population, currently holding 60% of the world's vaccines. Linda, how do you look at this disparity?
I think it's something we need to address globally. And of course, the ACT Accelerator, the COVAX, which is the vaccines arm of that, is playing a hugely valuable role. And that's, of course, a partnership between philanthropy, governments, and other partners who should be working in conjunction to make sure that they liaise with the manufacturers, with the research community, and national governments to make sure that the 1.3 billion people in Africa have access to these vaccines in due course. To give you a specific example, I'm here in the UK, and our government has already procured enough to provide 5 doses per head of population for the UK. And clearly we are not going to need all of that. So it's important that that is prioritized for other countries. So vaccine nationalism, you can understand where it's coming from. And there's a couple of sources for it. First of all, the vaccines are made by particular countries. Governments have invested in that development with pharmaceutical companies and academics. And so they feel a proprietorial aspect to it. And secondly, because it's such a crisis for so many countries, of course, they want to provide a vaccine to their populations first. But as we've heard from the World Health Organization and others, no one is safe until we're all safe. So we really need to make sure we share these vaccines, and as more of them are licensed for emergency use by WHO, which we hope AstraZeneca, Oxford will soon, or licensed by country regulators, we need to share these vaccines, and that is a global priority.
Well said. No one is safe until we're all safe. Also, I want to share with our viewers a staggering set of numbers here. WHO spokesperson Margaret Harris last month said that 95% of all the vaccinations that have taken place so far are happening in 10 countries. Hannah, what do you think has caused such vast inequality?
This inequality is nothing new. Let me give you just one more statistic to help illustrate this issue. 9 million doses have now been taken, have now been delivered to African countries. That's it. However, that accounts for just 8% of the vaccines which have been administered in the rest of the world. So if you think about that, this is really, it is an incredible challenge. At the same time, it's nothing new. Even if you look at the testing, the amount that countries have tested, Africa accounts for just 2% of all of the tests which have taken place in the world. And that despite the fact that Africa accounts for 4% of the COVID-19 cases across the world and 4% of deaths. Now, that is the reason why African countries account for so few compared to the rest of the world is really strong management. But the testing, the kind of stuff that everybody needs is the challenge. If you look at vaccines distribution for other diseases, other problems, African countries, low-income countries have been behind for years and years. It's why there are schemes like Gavi, why there's schemes like COVAX. But they fundamentally do not work, and we are seeing that they don't work. We need to actually think about doing something completely different this time in terms of building up the capacity for African countries to manufacture themselves, to really allow them to do what South Africa, India, and now the full African Union are requesting, to have derogations from intellectual property rights to be able to manufacture in their own countries and manufacture these vaccines, because this is a situation which is just not working, and it was not working and it still is not working.
Linda, what are some of the specific problems, challenges for these African countries? Did that have a lot to do with the pricing of vaccines, or the relatively weak infrastructure in some countries? Because if you look around, Africa, of course, is not a monolithic whole. Some countries are more developed than the others, of course.
Yeah, there's more than 50 countries in Africa, and they're at very different stages. I mean, the big challenges here, as Hannah was just saying, what we need to do is support countries to have manufacture in country. Testing is a huge issue across the continent. So the basic building blocks of addressing the pandemic are often not there. That said, there are a number of African countries who've responded quite well during this crisis and been very proactive. Those that, of course, learned from previous epidemics like Ebola with a good, robust public health response. But in terms of your specific question, what are the big challenges? Well, lack of capacity to manufacture in country. The supply chains, obviously, the first rollout is expected to be about 90 million doses. That's a big, big challenge for Africa to deliver if the supply is there. And then there are practical considerations. So a number of countries, I think 4 countries in Africa now, will be using the Pfizer-BioNTech vaccine. They had to apply to WHO AFRO to show that they were capable of doing that and had a plan in place that was reasonable. But the Pfizer-BioNTech needs to be stored at -70 Celsius. So you can imagine, even for more countries in the Northern Hemisphere who are perhaps used to the supply chain logistics of a vaccine like that, is a huge challenge for many African countries. And then finally, of course, the other 3 parts that you need for a successful vaccine campaign rollout are locations to deliver the vaccine, trained staff, clinical staff and others, and then encouraging people to come forward to be vaccinated. And those 3 things are challenging for all countries, but arguably they're particularly challenging in the African context. So we need to see how that develops in following weeks and months. So it's not all just about supply.
Right, we have about 1 minute left. Hannah, what do you think? What could be some of the solutions to solve some of Africa's problems these days?
Well, in the short term, of course, there are other partners. China, of course, is helping quite a lot of African countries now, has just announced supporting 53 developing countries, not sure how many in Africa. Certainly 4 countries have already gone and ordered vaccines from China. But there are also others. All the African countries are not just relying on COVAX, they're also using the African Union, who is being very, very proactive in supporting African countries. Fundamentally, we also have to remember there's countries like Seychelles who have done this for themselves. They're number 3 in the world in terms of vaccine administration domestically. This is not one story, but the inequality is there and it really needs to be addressed.
Right, also not just the inequality between developed and less developed countries, but inequalities within the African continent itself. Thank you so much, Linda Bauld, Professor of Public Health at the University of Edinburgh, and from Kuala Lumpur, Hannah Ryder, CEO of consulting firm Development Reimagined.